Now, you might have missed this on Friday afternoon. Friday afternoon is when people, companies, governments, ministers, politicians, businesses who've got something crappy to say that they don't really want people to pay any attention to, they dump it. They release it to the media on a Friday afternoon when everyone's heading off to the pub. It's the end of the week. We've got sport with the kids the next morning. And our minds are not on serious stuff. So it is the twilight zone where you send stories and bad news to die. Well, last Friday, having held on to it for weeks or months, Aisha Verrall, the Minister of Health, dropped a report, an analysis of the success so far of the new Māori Health Authority. Well, we'd have loved Aisha Verrall to come on and talk about this, but as you know, Labour ministers fundamentally have banned talking to people on the platform. We do not know why. So Aisha Verrall isn't here to explain her report, but one person who is, and who's had a good read of it and has something to say about it, is National's health spokesperson, Dr. Shane Reti, and he joins us on the line now. Dr. Reti, welcome to the platform. Nice to have you with us.
Good morning. Good to speak with you.
All right. Shane, can you first just tell us what this report, what this information snuck out on Friday is or was? What is it? It's a review, it's a report, It's a what?
It's an independent review by Ernst Young. And if we look at the lead up to this report, I'd heard from the sector months ago that there was badness in this report. And we wouldn't be surprised by that, because what we knew already before the report came out was that the Māori Health Authority had no budget planning for the first 4 months of its existence. It had breached the State-Owned Entities Act last year, no financial statements, and then they revealed recently 400 full-time equivalents at full establishment. That's a huge number. So we knew there were multiple red flags that we did know about. The Minister received the report on May the 5th. I asked her under the Official Information Act to release it. She refused to release it. That's a red flag right there. She then sat on it for 3 months, and meanwhile, in the meantime, she'd sacked half the board about a week ago. Everything was pointing towards what the sector was telling me was correct, and sure enough, when it was eventually dumped at the end of last week, its fact is even worse than I'd been led to believe. Every single page is an indictment of the Māori Health Authority.
Yeah. I can remember an interview we did, at the very beginning of the platform with Professor Des Gorman about the health reforms. And what he said was, there are no measurements, there are no KPIs here. It is simply looks like a bureaucratic restructuring with no goals, with no, definitive or aspirational goals that you can measure its success by. Was he right?
Des is our most experienced international health systems expert in New Zealand, and so he's hit this right on the button. And indeed, the reviewer says exactly the same. The reviewer says they searched for a 1-year implementation plan for, quote, activities, timeframes, resources, accountabilities and performance, and concluded there was no overarching plan. So exactly what Des was predicting is exactly what the reviewer found.
All right. How much have we spent on this Māori Health Authority?
So it's a $500 million enterprise. It's the funds they have under management. Tens of millions is what the authority has for its administrative arm. I mean, imagine 400 full-time equivalents. That's not going to be cheap. And it's not as if you were getting great outcomes, you'd say, okay, maybe that's value for money. Exactly as Des said, there are no outcomes, but there are actually more concerns, things that I wasn't aware of that the report brought up. For example, the reviewer pointed out that they were transferring people from Health New Zealand to the Māori Health Authority because they were Māori instead of, and I'm quoting here, staff with the necessary skills and experience.
Hang on, were they hiring based on race?
Absolutely. That's what the reviewer says. Yeah. It's exactly what the reviewer says.
Mind you, how do you know what competencies you want if you don't have a strategic goal, Shane?
Look, that's true, but you can still have a strong sense. You're going to need a CFO, you're going to need a COO. I mean, all of that is straightforward. You don't need an epiphany to know those sorts of things. And yet, as the reviewer says, part of the failings were they were transferring people who are Māori instead of staff with the necessary skills and experience. Also, deep interference by the board in the operational activities. What they say here is that, and I'm quoting again, additionally, on more than one occasion, the board has leaned in to operations due to a lack of confidence and assurance. We, the board, were uncomfortable and deeply involved in commissioning, and more involved than a board should be. 400 full-time equivalents in the operational arm was ineffective, and the board had to reach in and do operational stuff. What does that say about the people they've employed?
Okay, but half the board have been fired. Under what circumstances?
We don't know that. All we know is an announcement that came out about a week ago with 4 new appointments. They're only allowed a total of 8. So when you look at the 4 that have gone, which I think is Dr. Chris Tooley, Professor Sue Kringle, Sharon Shea, and a 4th one, they were just sacked. And 4 new people put in about a week ago, about a week before this report came out, actually. So deep trouble at the Māori Health Authority.
Has it delivered any positive, or does it look like it's going to deliver any positive health outcomes for Māori, who none of us would deny, if we break down poor health outcomes by ethnicity, are overrepresented at the bottom end of health delivery?
Absolutely agree with your last statement. To the first, there is no evidence that I can find for improved health outcomes, and I asked the Minister repeatedly, show me one. Choose anyone, any epiphany that comes into your head at this moment. Choose one that you think is improved and tell us about it, and we'll celebrate it and figure out how to do more of that. There are none. Even more worrying, the report says the competencies are so poor that there's been an underspend in significant areas, and there'll be years of further delays. So even in the go forward, they're seeing no evidence of any substantial increase in outcomes. But why would we be surprised by that? Their establishment documents, the regulatory impact statement, said they would show no benefits for 5 years. It's exactly one of the issues.
Okay, so they're delivering. Come on, Shane. There you go. They're bang on target.
Oh, no, they're worse than that. They're delivering on a bad target. None of that makes any sense.
Okay. Look, I've got to say, sitting back from outside and not being a health expert, this almost looks like a textbook creation of a gravy train for a chosen specific or specified ethnicity of people, build a bureaucracy, staff it with a certain type of people, and walk away and don't worry what it does. By its $500 million existence, it serves a purpose. You see what I'm saying? It just looks like the epitome of wasteful spending.
It's funding an ideology rather than funding outcomes.
Yeah.
That's what's happening here.
Yeah. So what would a possible national-led government do with the Māori Health Authority?
Oh, I'm already very clear in public domain and have been for a while. I will disestablish the Māori Health Authority. To spend that amount of money and have no outcomes, I can't justify that. I absolutely agree with you, the inequities that we need to address, but the Māori Health Authority is not the pathway to do that. We'll be much more effective with the Māori Health Directorate inside the Ministry of Health, providing strategic directions and outcomes-based. What the outcomes I'm going to focus on?
So like a task force?
No, an agency.
Okay, an agency.
If we look back to when, in my view, we were doing really well with Māori Health, it was back when we had a strong Māori Health Directorate, actually under the auspices of Tariana Tudia, when she was Associate Minister of Health. And they brought out a really good document called Korowai Oranga. And that really set direction. There was accountability targets. There were KPIs. We need to do that rather than this wishy-washy, what I call toothless and useless ideology.
All right. And we might save some money as well, or just better spend the money that's already been committed. Look, there's another health issue I want to raise with you. And as I said in the opening of my show this morning, really good aspirational goal that we improve our dental health care. And I think I, like many other New Zealanders, it is the part of my health I've neglected most because of cost, and I'm, of course, paying the price now later in life. Do you agree that improved dental health services and more affordable dental health services would be a good thing for New Zealanders?
Look, I think access to good quality dental health is always a good thing. And what we know is that we provide the safety net for those under 18. And the question that multiple governments have looked at is whether there's the ability to increase that provision wider than what we do with the safety net at the moment.
Is there? That's the question I'm asking you.
This is why multiple governments haven't been able to get there, because it turns out to be, well, there's several things here, turns out to be very expensive. And secondly, the question, and of course we're talking about the green policy that they announced on the weekend here.
Yeah.
The question is, so, okay, you're going to nationalise dental health. Have you talked with the dentists about that? Because you might want to ask yourself, even with the safety net, why is it that maybe only 2 out of 10 dentists participate in the under 18 government program? There's reasons for that.
So are you putting this in the too hard basket, Shane?
No, not at all. I think we need to be doing more at the earlier age group, actually, in the preventative and educative role that we can have with young people around structured toothbrushing.
So that is a no. That is a no to any program to improve access and affordability for adult dental care.
It's a no to what the Greens have described. It's a yes to increasing at the early stages of life.
Okay, so that's a no to the later stages of life. I just want to make this clear. You have no plans to look at adult dental health care, its affordability and availability in New Zealand.
We will look at it, but we have no plans to deploy it at this point in time. It's not our current
All right,
policy.
and I think it's somewhat a pity that the Greens have linked this aspirational policy to a tax system, because it would seem to me the two, you'd want to do good with dental health care. It doesn't mean that we should turn into some sort of Marxist state. Look, your position on that is clear. Your position on Māori health is clear. Do you know if are there other reports you're trying to get your hands on that are on any part of the health system that Aisha Verrill isn't giving you?
Oh, absolutely. The That's Us program from August last year, multi-million-dollar program that funded a vaccination program for Māori, where the lead person hired her nephew and her nephew's boyfriend or girlfriend, and just all sorts of badness, delivered the program way too late. Māori were already 85% vaccinated by the time it was delivered. Aisha Verrill received an independent report on that last year, still continuing to refuse to release it.
What's it called? Do you know who the report was by?
I do, actually. By Legal Advice ODIE is what's being described to me.
Okay.
And it's the That's Us program. She has continued to refuse to release that report.
All right. Well, let's keep an eye out on Friday afternoons for that, shall we? And good on you, Shane. Good on you, Shane, for not being off at the beach Friday afternoon, or off, fishing or something, or heading to the rugby, because it's always, as I said, it's an old trick. But when you get caught...
It is an old trick.
Yeah.
It is particularly a week before recess. That's an even better time to dump.
That's right. Are you going to ask some questions when the House comes back after recess? You're going to get into that?
Oh, yeah, really hoping to. I mean, this is a damning report, and it's an awful lot of money. And actually, I feel sorry for Māori as well, because I tell you what, the Māori Health Authority is such a disaster, it will set back any innovation in Māori health for decades. So there's losers everywhere here, actually.
Yeah, it's a real pity. I thank you very much for your time. Dr. Shane Reti, he is the National Party's health spokesman. Sounds like a shocker, but they're not going to do anything about your teeth. That's what I heard from him. Nope. Oh, maybe I'm just personally involved, because literally now I'm sitting here feeling I should have gone to the dentist a year ago. I still haven't. And I'm going to, and I know it is going to cost me probably 10 grand. Probably 10 grand worth of work to be done on my teeth. But I think, like all of us, you give it a brush your teeth, Ben. I might have been knocked around for all sorts of other reasons, which I'm not going to go into here.